Hi, this is Dr. Abdullah Khan, orthopedic surgeon from CarePoint Medical Center, Asl Khema. Today I will discuss osteoarthritis. We have this impression that osteoarthritis, we have been taught like this, that osteoarthritis is a degenerative phenomenon, it is a wear and tear disease. Now the concepts are changed. In the last 2 decades, a lot of work has been done on this issue from the molecular biology sides. And now the most important paradigm shift which is coming in our thinking of osteoarthritis is that it is an inflammatory phenomenon. It is an inflammatory metabolic disease. There are so many phenotypes. I do not reject altogether the theory of degeneration, but this kind of a phenotype with degenerative changes of aging in the joints, we do not find much. These days, we are getting patients with a lot of inflammations. They have obese, they have already associated comorbidities like diabetes, they have heart issues, metabolic syndromes, dyslipidemia, and then they have osteoarthritis. So rather than thinking osteoarthritis as an isolated entity, we have to look into osteoarthritis as a continuum of problems which are already present as a result of inflammatory metabolic phenomena. I would like to raise the if you see the problems, if you see the cause of osteoarthritis, there's multitude of causes. But there are two important things which I would like to raise is, one is microbiome derangement, which we call it as a gut dysbiosis, means that there are good bacteria, there are bad bacteria, there's an imbalance between good and bad, and there's a diversity of bacteria, more diversity in bacteria, you will see health, because a lot of studies, we do not have a standard model of makeup of gut microbiome that look, this is the makeup. No, studies are like this, that we have studied gut microbiome in healthy people, in diseased people, in obese people, in lean people. So we have an idea about different kinds of organisms. They are more in obese people, they are more with the sick people, they are more with the osteoarthritic people. So this is gut biosis is one very important factor in the causation of osteoarthritis. And second is insulin resistance, hyperinsulinemia. Whatever we are eating, there are so many responses to eating. Once you eat something, usually the upper GI and lower GI, they are responding in a different way. Upper gastrointestinal tract responding with some kinds of hormones, enzymes, acids, biles. Your blood is responding with, your pancreas is responding with insulin. The most important thing is, after eating, there are two important responses. One is insulin, and rest of the hormones which are released from the GIT, they are also doing some kinds of amplifications of insulin work. Second is gut microbiome. All the processed food ultimately in the colon, and from the colon, with the help of these bacteria, some metabolites are released which are used for our benefit, for our health. And the most important one is short chain fatty acids, and the most important among short chain fatty acid is butyrate, which is very, very important, very, very important for this. So if you look into, I said that I'm trying to put things in a very simplistic way so that we understand. Otherwise, lot of words, very busy slides, and ultimately the implication, the clinical implication becomes very difficult. The most important thing which I would like to raise is that from the treatment point of view, that if you attack these two factors, gut dysbiosis and insulin resistance, 70% of the work in osteoarthritis can be done very easily. From treatment point of view, what is more important today is that in the diet, I would suggest that try to reduce refined carbohydrates, try to reduce processed food, try to reduce fructose, try to reduce omega-6. Omega-6 is inflammatory. Omega-3, which is coming from plant sources as well as marine sources like fishes, algae, these we have to increase in our diet. Omega-6 is inflammatory. All these vegetable oils, they are full of omega-6. Omega-6 is needed only for inflammation purposes. Your body, if some pathogens are there, your body responds by inflammation. For inflammation, you need certain fatty acids which are created by omega-6. That's all. If there's a continuous supply of omega-6 in the body will enter into a permanent state of inflammation by these two things, hyperinsulinemia and omega-6. If you take fructose too much in your diet, you will go into a state of hyperinsulinemia or insulin resistance or in a state of chronic inflammation. Same thing omega-6 will do. So this you have to understand that from your diet, omega-6 is to be removed. Ideally the ratio should be 1:1, omega-3 and omega-6 1:1, okay, no problem. But right now, if you see all these modern diets, their ratio is 10:1, 50:1. It is dangerous. It is not good. Nobody can treat you. No medicine will work. No procedure will work. No injections will work. Correct diet. Ketogenic diet is one diet which is very favorably affect the gut microbiome in favor of health, which I suggest. If it is not possible from your side, try to reduce carb. Low carb diet is the best diet for you. Or a Mediterranean diet is okay. Or any kind of a paleo diet is okay. Low carb diet is okay. Or try to reduce. There are certain things, which are giving you too much of sugar, like fruits, fruit juices, soft drinks, dates, honey and all the preparations of honey, cakes, chocolates, ice creams, rice. If you really want to increase, you want to eat rice, you will have to do something to reduce its glycemic index. The best thing is that if you use rice, boiled rice, after keeping for 24 hours in fridge, it becomes little fermented. Glycemic index will come down. Or you mix some kinds of butter or butter ghee, glycemic index will come down. So this is diet that you have to address. There are certain medicines, unfortunately we are using to treat osteoarthritis, but they are increasing insulin resistance. For example, glucosamine. For example, COX-2 inhibitors. In the long run, they are going to increase insulin resistance and adversely affects your osteoarthritis. The most important thing I will suggest is a combination of low carb diet with intermittent fasting will address both the problem, gut dysbiosis as well as insulin resistance. Other than these, a good quality sleep, exercises, you don't have to indulge into a very hectic workout. Even, simple walking, simple focused physiotherapy will help you. On that, regarding physiotherapy, I always recommend, there's one person, Ben Patrick. He has a website, Knee Over the Toes Guys, and there are different programs for people. There's a Knee Ability Zero for people who are above 50. They are not very active. You can go to those websites to understand a specific exercise program. Exercise program will affect your gut dysbiosis. It will affect your insulin resistance. It will reduce your pain and you will feel better. Thank you very much.